You wake up on the bedside, you notice a lamp is placed, and you polish that lamp and suddenly a genie appears and he says, "Oh dear boy, thank you for freeing me. I'll give you 100 crore rupees right now." But the only thing is that you should have a degree from any Indian institute and you can have your 100 crore rupees right then and there. My question is to all the aspiring doctors as well as doctors who are practicing. Would you still choose the medical field? Would you still choose medicine? Or would you do something else with your life? Will you still spend 12 years of your life trying to get some good degrees so that you can start your own practice? Just because you're passionate about it? Will you spend all those years in a broken system, a system which will fill you with toxicity and torture you every day? Or will you do something else with your life? Hi everyone, I'm Dr. Anuj Pachhel and MBBS intern at Government Medical College Nagpur. Welcome back to my channel. And for the past 1 year, I've been working every day as an intern at GMC Nagpur. And I hate to admit it, passion which I once saw in medicine, I don't see that anymore that much. And I've developed this sort of love-hate relationship with this profession. That is my profession of being a doctor. There are some days where I feel like this is the profession which is the best. There is nothing else in the entire world. There are some days I wish I could change it into something better. There are some days where I wish I could change my profession and start something new. And I feel like everybody who starts working in a hospital has this feeling inside their head. So in this video, I'm going to be shedding some light on the reality of the medical profession and the sacrifice it takes, how that sacrifice is glorified in our country. A disclaimer is needed because I am not making this video to motivate you or to demotivate you or to neutralize you. That's not my point. My point is to show you the facts. And only through the facts will you be able to decide what is good for you. Because nobody told me the reality when I was studying for the examination or when I was in the field. So if you want to be motivated or demotivated, it's not my cup of tea. Because frankly, nobody else has the guts to tell the stories which I'm about to tell you in this video. Stories that I've seen, stories that I've heard, and stories that I've witnessed firsthand. Stories that completely changed my perspective on this field. This is not about my college or hospital. It's a problem that is spanning all India in all colleges, all hospitals. And if you have anything to do with the doctor, you should watch this video to the end. Picture this, you're a final year medico and you're studying very hard to pass your final year examinations. Medicine, surgery, OBGYN, pediatrics are the subjects and you are working day in and day night. In the morning, you are attending your clinics as much as possible. You're taking as many cases as possible, presenting them. And in the afternoon, you're studying from marrow lectures. In the evening, you're teaching stuff to your friends and your juniors. And in the night, you're revising. The stress is too high because this is the exam that will be defining your life. Will there be doctor added in front of your name or not? You do sometimes feel bad about it. But in the end, almost always, you go back to your bed having a good night's sleep. You feel so happy knowing that just in a few more months I'll be a doctor and I'll be able to prescribe the medicines, I'll be able to heal the people, and I'll be able to work in an environment where I'll be growing. And how crazy is that? That, my friends, is idealism. You're an idealist, everybody's an idealist till the last year of MBBS, till the last year where your life will not be chaotic, where the only thing that really matters to you is studies and studies. Kitna padna hai, that's all in your mind because you really haven't entered the medical field yet. You're just standing at the edge, you're standing at the border. Now comes the hard to swallow pill. Pass your exams, you become a doctor, you start working in a hospital, and you noticed seniors being toxic to the juniors and the residents being toxic to you. You see no fixed working hours. You see no sleeps, you see no personal relationship, you see no family. You see lack of resources, you see nurses not being adequate. You see so much death that you're not supposed to see as a human being. It's just work, sleep, repeat. All over. For the first time in your life, you're not thinking about studies. But this was your dream, wasn't it? You wanted to be a doctor. You dreamt of seeing patients, of understanding their disease and treating it. But amidst the overcrowded OPDs and the IPDs, there is seldom any time for you to practice what you've been perfecting for the last thousands of hours in the last 4 years. The idealist inside will think, okay, this is what it actually takes to become a doctor. Oh my God, but I have the passion. I want to do it. I will do it. But over time, a realist inside you will emerge. And that realist will make you realize one thing, is that our system is training us to be machines. Machines very, very efficient. Machines that do not require sleep. Machines that do not require food. Machines that do not feel emotions. Machines that do not feel pain. Machines that have no fixed working hours. You can turn them on just like a button anytime, anywhere. Machines that can be easily replaced. And machines that, if broken, can be easily disposed of. This is what the system is exactly about. If 50 years from now machines are taking the jobs of junior doctors, I wouldn't care because I knew that this is exactly what the system is training us to do. Why is it making us machines? Because we need to be as efficient, as fast as machines in India. There are countries that operate at 5 or 10% the speed at which the Indian system operates. If you have a patient with stomach ache in the morning, you will have it diagnosed as gastric carcinoma within 5 days. You'll also have a histopath report and you'll operate him within the next week. and he'll be on chemotherapy just shortly after that. As you take some other countries, you'll see that the pain in abdomen will go unnoticed till years, and only after many months will they actually end up getting a consultation in the first place. The costs are heavy for the patients, of course. In India, medicine field is not about earning money at all. It's about serving. It's about serving the people, and that's why we have to be machines, because we have to be fast. And that is the reality, my friends. Becoming a machine will cost you very, very dearly in your health. I've seen residents lose 20 kilograms of weight in the first year. I've seen them go from looking okay to looking tired and very, very ill all the time. I've seen people take various number of suicide attempts. I've seen people getting onto medications. I've seen people getting into addictions just because the workload is too high. It will cost you your mind, it will cost you your health, and it will cost you your relationships. And if you feel like I'm exaggerating, just go spend 1 week with any clinical rotation while a resident. You'll understand that 24 to 36 hour duties are very casually placed 2 or 3 times during the week. And a very good creator and a doctor fellow of mine put this beautifully in his TEDx talk. If you go to an airport and if you hear a pilot saying, I haven't slept for 36 hours, man, I feel very tired, I just want to go back home. I just want to spend some time with my family. I've not seen them since so many weeks. I don't want to drive this plane. Will you trust that pilot to fly a plane over a great sea, over a great ocean? Similar way, will you trust a doctor who has not had 1 second of rest in the last 36 hours, has not had proper food, who has not had proper time to get mental clarity? Will you trust that doctor with your life? Where just one medication, one dose error, one clerical error can cause such severe reactions, it can make people lose their lives. Will you trust that doctor? Well, you don't have a choice, because if you're going to a government college, that's what you're going to get. 80% of the Indian population prefers government hospitals because they don't have the money to afford the private ones. Does that make their lives matter less than mine or yours? Money is not a factor in calculating how somebody's life is worth. It's always been equal. Will they get the same level of healthcare? No, absolutely not. So my love-hate relationship is pretty straightforward. I love going to the OPD. I love seeing patients. I love seeing when the treatments I've prescribed actually work. I've seen people return back with 0 symptoms. And after doing some minor surgical procedures, see patients much more happier than before. That is the beauty of this profession. That is the part of my heart which is keeping the rest of it alive. But in order to get there, what do you have to go through? And is it really worth sacrificing everything for just this? Again, the idealist inside you will think, yes, it is worth it. They'll also comment down below, yes, it is worth it. But the realist inside you will only emerge after you've started working. And I totally bet you that if there was no penalty for dropping out, if there was not a barrier of 20 lakhs, 40 lakhs, 50 lakhs of quitting your residency in between, and there was no bonds, you would see residents quitting at an unimaginable rate. And the only thing that is stopping people from quitting is the huge amount of money. But still, in just the last 4 years from COVID, around 1200 residents have quit their residency. Not just that, my friend, I feel sad to say this, but around 135 of them have killed themselves. I know that the causes can be many, but what do you think is the most important one? What is criticism? Criticism is somebody sees you making a mistake. They notice it, they examine it, they scold you for it sometimes, and then they teach you exactly how to do it. For example, a first year obs and gynae resident trying to suture the episiotomy probably takes the suture wrong. The senior resident or the JR2, JR3 yells at her, try to scold her for the mistake, but immediately they hold her hands and show her how to do the procedure. That, my friends, is criticism. Criticism is careful evaluation, followed by the teaching of the correct technique to whoever you are criticizing. When you're new in this field, you are bound to make mistakes. There are certain things that you will not be able to do. There are certain things which you will not be able to diagnose. Because you, in the end, are a junior doctor. And that is where you face a heavy criticism. People will scold you from right to left, but you'll also see that only few of these people will actually teach you the correct way. Those, my friends, are the real heroes. I'll give you an example. When I was posted in a unit, we were instructed to quickly process the patients, evaluate them, treat them, and let them go, because this unit had a heavy inflow. So you can't have patients backlogging, because repeatedly you will have admission days. So you have to just keep the patients moving, treat them, and send them back home. Send them back home or transfer them wherever they are needed. I noticed that a lot of times my seniors used to yell at the residents and even at interns, why are you not working fast? Why are you not getting this done fast? And the only reason was they wanted this all to go faster. And it was a completely legit reason. They even taught us some techniques on how you can make your workflow smoother in the hospital. And that, my friends, was criticism, because when they were residents, they were taught the same thing. Let me tell you exactly what toxicity is. I've already spoken about how prevalent it is in the medical field. I've already made a video about it. But I'll tell you exactly what I've seen from my eyes as a person who's working in the hospital. I've seen a toxic resident telling the interns in the ward to take out all the intracats which are placed in the patient, even if they are in, and put all fresh new intracats. every day because the intern did not satisfy the ego of the resident. So what's happening is that you are spending nearly 2 or 3 hours just doing the intracats of so many people. I assume this is only a Maharashtrian thing because all the other places nurses do the work. Here I don't see them working with intracats at all. It is costing the hospital quite a lot because each one of these intracats is roughly 450 to 500 rupees. And it is costing you time, effort and energy. Getting good at this skill, that is very good for you. Of course it's good for you. How wasteful it is, how painful it is for the patient you try to do that procedure. That, my friends, is toxicity. Toxicity can take many forms. It could be scolding you in front of the patient's relatives, physically abusing you in the side room. One story which one of my friends told me was that a young resident had joined in one of the units, not my college, some other college, very, very reputed. And there were 3 seniors of him that used to every day physically abuse him in the side room. Used to make him do things which I even can't talk on camera. He tolerated all of this for 1 month. But his mind was something different. And one day he snapped. Not in a way that you think he did. He did not commit suicide, my friends. He used both of his fists to break the nasal bones of the people that were causing him that much torture. The people had to undergo rhinoplasty and had to go a corrective septoplasty just to have their face presentable. They didn't touch him after that. Similarly, one day my batchmate during my internship right here at my college, almost 12 hours in the department, was there from 8 to 8. He did all his work and he collected so many reports at the end because so many patients had been admitted and so much workup had to be done. And in the end, while he was attaching the reports to the patient's file, his senior comes up and tells to him, "You have not done any work for me today and that's why I'm marking you absent. You will have an extension for 7 days. And my guy lost it. He tore all the reports of the investigation he had ordered. He took the files, he tore them in front of the resident, then just went away, telling him that if I was absent, who did all this work? So that's how it is. If you are trying to perpetuate toxicity, there are some people who will be submissive, who will take it easily. But if you go beyond, there are certain people who might snap, and they might snap any of your bones or maybe your neck at some point. So that is the thing, that if you're a senior who is watching this, who believes in toxicity, instead of criticism, I have no problem with criticism, whatever you want, but in the end teach them the correct way. But if you propel toxicity, it will not be tolerated, not by the viewers of this channel. Now here's my take. Here's the love-hate relationship which I was talking about. I love this profession very much. I love working. I have no problem with working at all. I have no problem with the workload. The problem I have is with the toxicity. If you tell me to do 35 intracats in a day, I'll do it. No issues. Because that's part of my job. It's what I'm supposed to do. If you ask me to stay 1 or 2 hours after my duty, why not? Let's stay. Let's help you guys. But what I hate is the toxicity. What I hate is this culture where there is so much disparity between seniors and juniors, where seniors think they're gods, where in the end they're just 1 year ahead of you, just because they were born 1 year earlier, to be very honest. I tell you, there are days of my life where I had spent the most amazing time with my seniors, that I wish I could relive those days. I had 12-hour shifts, I had night duties, I had emergency duties. I had such a heavy workload in the trauma care center. But if somebody were to give me the posting again for a year, but with the 2 residents I worked with, I would do it again. And the reason is they were not at all toxic. They were critics. They used to guide me, they used to correct me, they used to teach me. But never once did they ever be toxic to me. Not all seniors are going to be like this, but a lot of them are going to be like this. Don't tolerate it. This probably is the most important chapter of this video. So if you ask me when did I decide to become a doctor, man, my honest answer to you would be when I decided maths was not for me. That is when it was automatically decided for me that you're going to be a doctor. A path was created in front of me that I had to walk. A neat aspirant today comes up to me and tells me that I want to be a doctor, and this is my true passion. I'll appreciate them because they have clarity. But at the same time, I wish I could show them what it's actually like to work as a doctor. In fact, till you are a final year student, you still don't understand what this path is all about. Only once you work in the hospital where you see the patients, where you see the condition of our broken system, you'll understand what it actually means to become a doctor in this condition in India. And it is nothing of what you expect. And that's my problem. You have already spent 4.5 years coming to that point. If you feel like you want to discontinue, you don't want to be a doctor after 5 years, after 5.5 years of MBBS. You can't just leave now. You can just do 3 years of residency and then you will be a very good MD physician. Just 3 years after that, you can be a super specialist DM cardiologist maybe. Or maybe just do 1 year of fellowship in pediatric cardiology and then you can finally end. Why are you stopping? You're already here. If you stop right now, you'll lose your entire progress of 5.5 years. You'll be set back in life. It will be like you're back 18 years old and you have nothing to show for. Forget getting married, forget having kids. Nobody will give their daughter to you. You have literally no source of income. You're 24 years old and you still live with your parents. Do you feel it? That is pressure. That is exactly what I'm talking about. This field does not allow you to get out at all. If you're in first year, you will not be able to get out because of such huge financial burdens. There's a penalty for dropping out, or there is a bond which you have to pay. So the first 4.5 years you can't leave. After 5.5 years, you are done with your MBBS. So why not just put 7-8 more years into it and just finish it once and for all? The 7-8 years of your life that are the most precious ones. The 20s of your life which you'll never ever get back. And after that is just a decade after decade passing in a blink of an eye. So instead of now pursuing your career, academic growth, you are now pursuing it just because of the pressure. The pressure that you can't leave. And the pressure will get more serious and serious every step that you climb. If you're doing your MD, you have finally cleared your NEET PG examination. Congratulations to you, you got your dream college. You go into that college after 2 years, you feel like this is so toxic. If I live one more day, I'll kill myself. And if you want to quit, just one more year, complete your MD and then we can think about it. Then you are again trapped for 1 year. And guess what? When your MD will be done, they'll say the same thing. And when you are in super specialty, if you feel like you don't want to do this, guess what? You're so deep right now that there is no way you can break it. You're left with so many degrees and 100 crore rupees from the genie. But in the end, what did you sacrifice? Sacrifice your true passions because of the pressure. I love the fact that this course is so long, and it actually makes me really happy that once you are at the end of it, you will be in the apex, you will be the most qualified person, you will be the person that anybody comes to. Yeah, but the hate part comes over here. What if you want to live in the between? What if you feel like you're continuing this instead out of pressure and not out of passion? Because I can tell you, as a person with a YouTube channel, a person who started content creation just 4 years ago when lockdown hit, we are at 980,000 subscribers. By the way, subscribe if you haven't already. Making videos such as this one takes time, effort and energy. So please do subscribe. Thank you so much. If I spend the next 8 years of my life perfecting every little nick and cranny of YouTube, or maybe social media in general, there will be no stopping me. Just look at Ali Abdal for a change. He left his job as a doctor because of the same dilemma that I am having today. And he took all of that energy, those 12-hour shifts, he channeled that into his channel. And look where it brought him. He quadrupled his growth speed and continued making videos that would inspire people. He was also a doctor. He was also working in a broken system. The NHS is not very much different from the Indian system. And in the end, he took a path because he knew he was going to be successful. This is the last chapter of this video. 50 years ago, India was a different place. So the basic idea was, if you had a degree, you would be eligible for a higher pay job. And if you had a higher pay job, you would be able to uplift your entire family from poverty. That was the basic ideology behind this. So everybody started working on education. The people who at least had access to it anyways did. And they went ahead to get degrees, and that degrees pulled their family out of poverty. That's the basic story. 50 years ago, there were not as many jobs, and surely people could not take as many risks as we do today because they had to show up for their families. But if you're watching this on your mobile phone, then you are already way past that point. As a second or third generation children, we were told the same thing, that if you get a good degree, you'll be able to land a high paying job, and that high paying job will keep you happy forever in your entire life. Well, that was very true, but recently there are more people applying for jobs than are actual jobs. Just take a look at this footage. This is from Pune, where a company offered job placement to engineers. These are all engineers, by the way, and they are standing over there like they are standing in a mela. Imagine the struggle. That basically means that even if you have a degree, it does not mean you will get paid. Especially with the recession hitting, engineers are affected by this way more than us doctors. So definitely degrees don't mean as strongly as they did before. For business owners, having a degree is just a backup plan. And you know what I find really surprising in all of this? If you look at the internet has provided us with so many new opportunities and so many new ways we can monetize, and so many ways in which we can do whatever we want from wherever we want. But at the same time, I feel bad. If you scroll Instagram, you'll definitely find these content creators who are get ready with me, changing room type content creators. And if you just look through their page, you'll definitely find a website link, maybe an OnlyFans or something. And if you go look at the statistics, they are probably making more than a doctor will make in their entire lives. And these people are Indian. I'm not comparing some US based female to an Indian male. I'm not doing that at all. Problem is, it is being so normalized. What earlier used to be considered as leaked MMS or a very shameful thing, you can just have it for 500-600 rupees online now. And where do you think the beauty female influencers will go when their get ready with me reels are not working? They'll turn to this, of course. The Sims that they actually call fans will support them all through their lives. So clearly degrees aren't the only way you can make money. You can sell your soul online and you can make money out of it. But for genuine people who are actually doing some really valuable things, there are jobs more than ever right now in the online space. And the old world concept has weakened a bit. So my love-hate relationship is pretty simple. If your degree is just your backup plan, why spend so much time on a backup plan? Why just not spend all of that time into the front plan, or the plan which is the first, and grow something beautiful out of it? So the conclusion of this video, why don't you just drop out? Stop complaining about all of this. Stop being such a softie. Just drop out and live your life as you're meant to be. Well, that's why this video is called the love-hate relationship. There's still a part of me that believes that we've got some incredible potential. There's still a part of me that feels like this is the only profession that I really want to be at. I'm almost at 1 million subscribers, but I still feel every day more happy when I see a patient and make him feel better than I do while recording these videos. And I guess every medical student who introspects and thinks deeply like me arrives at this conclusion. They want to continue in the medical field, but they don't want toxicity. They want to continue in the medical field, but also want money. They want to continue in the medical field, but they don't want to be machines. And that's the direct result of why you're getting dermat and radiology as the topmost branches, surpassing medicine, surpassing orthopedics, surpassing surgery and gynecology. It's an end branch. You don't have to do anything after it. Dermat, for example. You don't have to spend multiple years perfecting it. And you'll get your backup plan or your frontward plan in just a few years. There's not much toxicity over here. Workload is not as much as compared to the clinical branches. So that's why they are on the top. There is literally no other reason. And coincidentally, they are the branches that pay the most. So I really don't know the future. I might drop out, I might not do PG, or it might turn out beautiful. I don't know. But I know this for my own self, that whatever I do, I'll be excellent at it. Because I know myself and I have the confidence within me to achieve great limits. Just like you. That's been it. That's sort of the love-hate relationship that I feel with my medical profession. I would love to hear your thoughts down below in the comments, and I'll see you in the next one. Please do subscribe, share this video to all your friends. Bye.